Hi, this is Dr. Priya Nayak. So I am senior medical oncologist and with Medical Bhubaneswar. As we know, March is a colorectal cancer awareness month. We'll be discussing some colorectal cancer awareness. Before knowing about colorectal cancer, we should know what is colorectal cancer. Colorectal cancer is basically refers to the abnormal growth in colon and rectum. So why colon and rectal cancers are discussed like in a group together because they share like many common features. And before we dive deep into colorectal cancer, let us understand a little more about colon and rectum. So colon and rectum are basically the distal end of our alimentary canal. Our large intestine is a hollow tube-like material, tube-like structure. So it ends into the anal opening that helps in excretion of digestive or wastes from the body. The primary function of colon is to absorb the nutrients, the absorb water and nutrients from the food material that we have taken in. After which the waste products of digestion are passed to the rectum for storage and eventual excretion. How do colorectal cancer occur? So colorectal cancer occurred in the lining of colon and rectum that start growing and dividing uncontrollably and resulting in a mass of tissue called polyp. But not all polyps are cancerous. Um, um, there are some polyps which are cancerous, which continue to grow, and the cancerous cells in the polyp invade other tissues such as in blood vessels and lymph nodes and metastasize to other organs. So it usually takes years, maybe up to 10 to 15 years to develop into a colorectal cancer stage. So now coming to risk factors of colorectal cancer. So what are the factors which actually lead to colorectal cancer? There are factors like non-modifiable and modifiable. They can increase the risk of colorectal cancer. These may include age more than 50 years, a personal medical history of polyps and colorectal cancer, the first degree relative, those who have colorectal cancer, or there are history of any conditions like inflammatory bowel disease, or like inherited syndrome like Lynch syndrome and familial adenomatosis polyposis, or obesity. That is, it has got stronger link in colorectal cancer in both men and women. So in 2020, it had been found that around 1.9 million new cases of colorectal cancer were being reported. So out of which it accounts for up to 10.2% of new cases, and then it accounted up to 0.9 million deaths that were caused by colorectal cancer. This incidence and death can be actually reduced by early diagnosis and appropriate treatment. So what are the many factors that has been led to high incidence of colorectal cancer and high mortality rate? They include lack of awareness among the patients, overlapping symptoms such as GI conditions, which are often ignored by primary physicians. The misinterpretations of the symptom can lead to delayed diagnosis of colorectal cancer. The signs and symptoms of colorectal cancer that can actually help us to determine that if we are having colorectal cancer are like blood in the stool, or that there is incomplete bowel emptying, or there is narrower stools than usual, or we have abdominal pain and cramps, or there is bloating sensation or fullness, or there is pain due to flatulence or easy fatigability. These all are common features of colorectal cancer. So if the symptoms actually persist for 2 weeks, we should go and get ourselves evaluated, because diagnosis of colorectal cancer at an early stage can reduce the mortality rate by up to 90%. So what are the different modes of prevention of colorectal cancer? There is actually no definitive ways to prevent colorectal cancer. The most important measure we can prevent from getting colorectal cancer is by screening. The polyps in the colon or rectum usually takes a minimum of 10 to 15 years to develop. So if we get ourselves screened or get a colonoscopy done at a regular interval, we can actually get to know about polyps, and we can get rid of polyps and prevent ourselves from getting colorectal cancer. So when to start the regular screening? So it is recommended that individuals aged 45 years and above, or those who have family history of colon cancer, must undergo a regular screening test for colorectal cancer. in both men and women, obesity also increases the risk of colorectal cancer. So maintaining a healthy body weight and a healthy food habit consisting of fruits and vegetables, avoiding red meat, taking a high fiber diet can actually maintain a good weight, and that can prevent from getting a colorectal cancer. Again, alcohol intake has also been associated with colorectal cancer. So reducing the intake of alcohol and reducing the smoking incidence can also reduce the risk of colorectal cancer. So let us now stand together and fight colorectal cancer just by spreading awareness and by ourselves knowing the signs and symptoms of colorectal cancer, and making others also aware about signs and symptoms of colorectal cancer. By this, we can reduce mortality rate of colorectal cancer. Thank you.